So, good morning, everyone. My name is Ethan Benaventura, a student physical therapist of Velez College, and today I will be discussing about vital signs. Okay, so before we begin, we'll be having a pre-test, like an oral exam lang, to see if you have any knowledge of vital signs. So, for my first question is, ma'am, do you know how many vital signs are there?
Um, 4.
Correct, opat. Sige, so, next ma'am, what are these vital signs that we should be taking? Since upat man yung mention ma'am, maka-mention baka sa upat ma'am, or kanang any that you know lang of.
BP,
What's, BP, heart
blood
rate, unsa pa?
pressure, heart rate, pulse,
Pulse, unsa pa?
glucose.
Okay, sige.
Pero kabago na yun.
Nai-usapper. Okay, we'll be discussing that further in the next slide. So next when should be the optimal time to take vital signs?
Kabago.
Sige, okay
I
na na?
don't know.
So next is, mention mo ka ma'am na magkuha og pulse, di ba ma'am? Dire, ni point pagit ka dire. So, kibawa ka sa name sa artery na pagkuhaan na pulse ma'am.
Wala.
Sige, okay ra. So last, kibawa ka sa common tools that ato igamit para mo take og vital signs.
Sphygmomanometer.
So, unsa may kuha na kuhaan ma'am?
Blood pressure.
Unsa pailain?
Ano kabago?
Sige. It's okay. At least kani siya, it's just a refresher, or if kibawa ka sa kanang kuan. So before na sad we start with the discussion proper, we have here our icebreaker. So ang kani ma'am, may guess the word lang ta ma'am ha. So na ko yung mga set of pictures here ma'am na akong gibutang, and then I want you to guess the word na related di siya sa vital signs ma'am. So first ma'am, na heart diri, na rating diri, unsa may meaning ana?
Heart rate.
Okay. Next ma'am, kani ma'am?
Blood pressure.
Next ma'am. Sakto, kani unsa man ni ma'am?
Lungs rate.
So, sakto na to ang lungs ma'am, pero ang kani ma'am is respiratory rate. So muna siya ang fourth na katuwa ni mo na mention. And kani ma'am,
Ano man na?
kani ato i-focus ni ma'am. Kani sa ka na.
Temperature.
Wow. Good. So sa fourth book vital signs ma'am na blood pressure, pulse rate, respiratory rate, and temperature. So first na to discuss is ang temperature. So ato sa day introduce ang unsa ang vital signs. So the four vital signs are called temperature, pulse rate, respiratory rate, and blood pressure. So ngano importante man na mag-take ta og vital signs? It's because they reflect the body's physiological status and provide information about the person with the current condition or state of their health. So ato lay Bisaya ma'am na kanang ang kaning kaning mga vital signs kay motabang ni siya kanang give og kanang more overview sa overall health sa usa ka tawo na wala pa gitanaw kung unsa gisakit or unsa kanang ilang gibati ma'am. So next first ato introduce the vital sign is temperature. So what is temperature? Body temperature is the balance between heat produced and heat lost by the body. So meaning ana ma'am, imong body can produce mag heat unya usahay, and then also mo hawa sa heat sa body. So ang kanina ang mo regulate anina body temperature ma'am is the hypothalamus, which is located on your brain ma'am. So below na siya, munang hypothalamus kay ubos siya sa thalamus. So next slide na to ma'am is, so natin to look ka body regions na kuha na to for temperature, mainly the oral or tympanic, the rectal, and the axillary. And then we'll be measuring these kanang the temperature using Celsius and Fahrenheit. Pero usually diri sa Philippines ato igamit is Celsius. So for the temperature of the oral and tympanic ma'am, na body region is 37 degrees Celsius. For the rectal is 37.6 degrees Celsius. And for the axillary is 36.4 degrees Celsius. That's kana mo na ang axillary ma'am, na siya ang kanang imong armpit dapit. So kana na range ma'am within 36.4 or kana 36 to 37 muna siya ang normal, or 37.5 okay ra pa na siya. If malapas siya ana, there's a term called that, pero later na to discuss. So for the Fahrenheit, it's 98.6 degrees Fahrenheit sa oral and tympanic. For the rectal is 99.6 degrees Fahrenheit, and for the axillary which is 97.6 degrees Fahrenheit. So pwede ni siya i-convert ma'am, pero we'll not get into that kay dili ka na nato kinahanglan na yun. So what do you use in taking temperature? So muna siya ang one of the tools that we'll be using for taking our vital signs is, which is the thermometer. So first na atong igamit ma'am is the glass thermometer, and the next will be digital thermometer. So in our modern times today, we'll be using the digital thermometer na lang. Kay, the glass thermometer man good is somewhat dangerous because ang nasa soda na is mercury. Also, ang idea na is if ang mercury kay mabuak din na siya na glass thermometer ma'am, it would cause more harm than kanang help sa person and sa kanang mutate sa kanang vital signs. So next, kay if ang temperature ma'am increases above normal levels, that's what we call hyperthermia. So kabantay ka ng fever ma'am na i-touch nimo sa person ma'am kay init. So muna siya tawag na hyperthermia kay iyang kanang body temperature kay ni-increase above normal levels. Pero sad, if temperature decreases below normal levels, then that's what we call hypothermia kay decrease. So if hyper ma'am, increase. Hypo is decrease. Same rin na siya sa hypertension which is high blood pressure and hypotension which is low blood pressure. So next we'll be discussing is pulse rate. So what is a pulse? Before natin i-discuss ang pulse rate kay a pulse is an index of the heart's rate and rhythm. Pulse provides valuable data about the person's cardiovascular status. So ang pulse kay muna siya measure sa overall cardiovascular status sa usa ka person. So next ma'am kay so there are 9 different pulse sites na commonly used nato but some of it na dili kay nato gamiton gid pero ato lang discuss most ang 9 kakuan. So first is the temporal pulse site. So asa ni siya makitaan? Makita na siya sa at the side of the head. Try daw ma'am will be using so before sa mo start ma'am kay try og take og pulse site kay atong igamit na mga fingers is usually index and middle finger and kay mo na siya ang easiest na access nato sa mga fingers. Lisod man if kanilang duha to gamiton ma'am, lisod man siya and ang thumb hindi na pwede gamiton kay na siya iyang kanang pulse of its own. So first is the temporal one which is the side of the head. So kabantay ka na murag labad imo unya na murag magpitik-pitik. Yung labad na jud kaayo o kana pina Professor X muna siya. Temporal na siya na kanang pulse site. Next is the carotid. So ang carotid is at the side of the neck. So before na so atong pagkuha na ma'am is ato gamiton ang middle of the neck as kanang basis then move murag 2 fingers to the left or right and then apply pressure. Move tag 2 fingers kanang 1, 2 and apply a pressure. Na-feel na nimo. So next is the apical. Muna siya ang kanang murag point sa heart kung asa kuan kana siya ang murag apex sa heart so ubos sa kan. Dili na to i-go in. Dili na siya diri man siya sa kanang sa ribs man siya na area dapit. So ma-feeler na nimo siya. Usually ato nagamiton when we're using our kanang stethoscope. Pero ma-feel sa na nimo bro. Next would be the brachial. Ang kanima muna siya atong gamiton na pulse site when we're taking our blood pressure. Abantay ka na if mo take ang blood pressure ma'am kay ibutang ang stethoscope diri kay para madunggan ang kanang what they call ang pitik. So ato na kuan ma'am is muna siya, di ba? I-fold nimo sa imong elbow na may fold sa imong elbow atubangan. So near to duol sa imong body, nabutang kag kanang duol sa imong lawas na kanang part, imo ibutang imong fingers dira. I-apply kag pressure. Isod siya kuan kung ikaw ra usa. Sige lang. So next would be the radial. Muna akong giingon ganyan ma'am na ang usually na atong kuan na pulse sa pulse rate a radial na artery because mas ma-feel na to dira ang kanang pulso gani niya mas duol siya sa kanang kuan patient. So unsa to pag-feel na ma'am ato igamit ang thumb as basis ma'am then move ta downward to our wrist area kung asa dapit ang thumb then mo apply ka og pressure. Ma-feel ka. Sige, next would be the femoral. Kani muna siya ang mga dili ka na to gamiton pero in case to case basis na kanang di ta makakuha pulso from the radial, brachial, temporal or carotid pwede ta mo gamit ano ng mga pulse sites. So the femoral is near your groin area ma'am. So, ay lang okay dili na i-feel kay kanang sensitive na siya na area. Next would be the popliteal. So ang popliteal na artery is just located behind the knee. So para ato na makuha ang artery mas duol gyud siya sa imong body kay dapat ka if mo feel man gani ka na in a patient or client kay mas dali siya ma-feel if naka-bend ang knee gamay and then naghigda kay tungod sa gravity gani. And then last would be kay since na may pulse site ako na lang giusa kay makita ra mo siya in one picture ang posterior tibial and dorsalis pedis artery. So ang dorsalis pedis artery is kanang found in above ay kana ganing sa above sa imong foot and then ang dorsalis pedis is behind sa imong foot.
Dorsalis pedis.
Okay. So next is pulse range. So normal pulse rate varies depending on age. For a healthy adult, the normal resting pulse range is from 60 to 100 beats per minute. So mo-measure ta og pulse rate in beats per minute. So ang need sa nato na tools ani is either an analog clock or a stopwatch na mo kuan siya kanang 1 minute. So every time mo pitik na ang pulse, i-feel nimo mo na sa lanter ipitik nimo in Bisaya lang kay or kanang if ma-feel nimo ang pulse mo count ka na in 1 minute. And then although dili siya advised, we can shorten this period na 30 seconds lang and then you multiply it by 2 pero dili siya advised yun. So ang abnormal, ha?
Pila ang normal?
Ang normal na range is 60 to 100. If mulapas na siya ana, for example, 120, so an abnormal na rapid heart rate over 100 beats per minute, that's what we call tachycardia. And then, abnormal slow heart rate below 60 beats per minute, that's what we call bradycardia. Sige, next. So, nasa tayo pulse reading. So, kani siya is the usual pulse 4-point scale na usually igamit sa medical na teams. So for the grade 0 muna siya ang absent pulse, makaingon ta na patay na gid ang patient ana kay absent man. So 1 plus is ma-feel nimo siya, that's palpable but thready, so di magwala-wala siya, and weak, so di kay siya ma-feel. And if mo apply kag pressure gani kay dali na mawagtang na pulse. So if inaana man gani ang kanang imo ma-feel na pulse, so you grade it as 1 plus. So ang normal is 2 plus. So it's normal, easily identified, and not easily obliterated. Now kung mo apply kag pressure, kay di siya dali mawa. Next would be 3 plus, which is increased pulse, moderate pressure for obliteration. So unsay moderate pressure na if mo apply kag moderate pressure, ana na siya mawala, pero if kanang normal lang na pressure na imo i-apply, dili siya mawala ana. Last would be the 4 plus, which is full bounding. So ang bounding kanang kusogid kayo iyang kanang pagkuan. So kabantay ka anang if gikan kag exercise dagan mo na siya ang kanang more bounding na pulse na kusog jud kay siya. Then and cannot be obliterated na bisag kanang moderate pressure or kanang firm gid na pressure yung ibutang kay di gyud mo siya mawagtang. Mo na siya ang 4 plus. So next, muna siya ang respiratory rate or respiration. So what is respiration? Respiration is the process of bringing oxygen to body tissues and removing carbon dioxide from it. The lungs play a major role in this process. So respiration is the act of breathing, which refers to two processes: external respiration or internal respiration. So external respiration, kay mura na siya ang breathing out. So exhaling. Ang internal respiration, that will be inhaling. So inhale, exhale. So, characteristics of respiration. So, ato pangitaon ng sa characteristics. So, first is respiratory rate. So, muna siya ang indicates the number of times the person breathes in and out in a minute. So, ang kani siya, when we measure respiratory rate, we measure it as cycles per minute. So, in cycles per minute, because we count one when a person breathes in and breathes out. So, breathe in, breathe out, that's one cycle. So, in a minute, gihapon na. So, depth. Estimated by observing the movement of chest during inspiration, which may be deep or shallow. So kabantay ka na when we were kanang in an exercise or in na paspas ato movement, or sometimes because of kanang natay sakit, kay sometimes shallow ato breathing, kay we need kanang paspas na oxygen sa atong lawas. So ato na i-check if maka deep breaths ba ang patient or kanang shallow ba ang breath sa patient. Last would be rhythm, indicates the equal interval between two respirations. Kaya ato i-check if ang two respirations kay kuan gani siya, dili ba siya equal. Like for example, ang usa kay long, then next nila ang first two kay long, then ang 3 ug fourth na cycle kay dili long. So muna siya i-check na tong rhythm sa respiration. So muna siya respiration, breathing in, ang chest mo expand, and then ang diaphragm kay mo flat. And then sa breathing out, ang chest mo contract, ang lungs kay more siya gi-squeeze niya. May exhale ka sa imong nose or mouth if unsa imong depende. So next, normal respiration is autonomic, effortless, and regular. So sometimes kay bantay ka kung so kanide ay important sa niya na kuan kung mo take kag respiratory rate kay dili nimo ingnon ang patient na nag-take kag respiratory rate. Why? Kay kung mo take ka ani nya maing ka mo take ko sa imong kanang pagginhawa ma'am ha, kay ila na usbon ilang paginhawa na para masud sila sa normal na respiratory. So when you take a respiratory rate, ang imong button na is either imo siya idungan sa pulse rate, or example, nag-take ka sa pulse rate, niyo mo na ka ma'am or sir, kanang mag-take og another minute to take your pulse rate, pero ang imo na day gi-take ana is ang respiratory rate. Unya, another tip for this is that para ma-feel gyud imong respiratory rate, pwede ka maingon sa imong patient na imo ibutang imong hand sa luyo kay makaingon, at least mo sila na reassured sila pero nag-record din ka sa ilang respiratory rate. So, the normal adult rate of respiration is generally range from 14 to 20 breaths per minute. So, muna siya in a minute kay 14 to 20 breaths per minute siya, or cycles per minute. Cycles per minute na itong gamiton dyan. So, there are these factors affecting respiration. And then, these are some that I've listed. So, age. So, ang age, maka-affect na siya sa factors of breathing. Kaya usually, shallow naman na kaya di naman kaya na ito magamit ang atong mga muscles when in taas-taas na tag-edad. So, smoking also affects that because imong lungs kay dili na kayo maka-intake of oxygen because of all the nicotine in your kanang for smoking. Medication, sometimes kay makakosad siya ana, and then pain, whenever sakit atong mga muscles, and ana, kay maglisod mong kita ginhawa ana. Next, lastly, is the blood pressure. So, blood pressure is the force exerted by the blood against the vessel walls. So, ang arterial wall, which is measured in millimeter of mercury or mmHg. Kadong, di ba ka ng mmHg, ma'am?
La.
Muna siya ang pag-measure na to sa blood pressure. So, every time mo, nakadungog ka ng 120/80. So, ang pag-ingon na kay 120/80 mmHg. So, muna siya ang sakto na pag-measure sa blood pressure. So, next, duha ka buok pressure ang gi-measure ani. First is the systolic and the diastolic. Nakadungog na kag-systolic and diastolic, ma'am. So, ang systolic, ma'am, moay na siya kanang systolic is the one above. So, mo siyang 120, for example, over 80. Ang 80 is a diastolic pressure. So, nga naman, kay ang systolic pressure, ma'am, kay muna siya ang maximal pressure exerted on the arteries during contraction of the left ventricles of the heart. While ang diastolic pressure is the amount of pressure exerted on the arterial wall with the ventricles at rest. Muna, ma'am, inika-squeeze na to sa sphygmomanometer. Katong box ba ko na sphygmo, ma'am. Muna ang first pitik, kigikan mo siya gi-squeeze katong muna mo contract ang left ventricle, and then at rest, pinaka-last na pitik muna siyang diastolic. So, what are the tools for measuring blood pressure? So, blood pressure can be taken by using a sphygmomanometer and a stethoscope. So, unsay gamit sa stethoscope, dato sa pag-measure na blood pressure, ang paggamit lang gid ang stethoscope is to listen to the first kanang tick, and then also the last tick na strong. So, normal blood pressure in an adult varies between 100 to 140 mmHg sa systolic and 60 to 90 mmHg sa diastolic. But may vary depending on individual other factors. Kasi sometimes there's medication na makapalow og blood pressure. Yeah, sometimes if you can kagkaon or nana, or you can maka-exercise, maka-affect mo na sa blood pressure. So, ang optimal time to take blood pressure is when the body is at rest. So, before example, in a clinic setting or kanang example magkuha ka blood pressure mo ana mayud ka na di kan ba ka nag-walking ba or running nya dili gyud na
vital signs.
Tanan na vital
The
signs.
body is at rest.
Tanan na vital signs kay apila siya sa factor na mo affect sa mga vital signs. So kani man siya, ma'am, since we're done with our discussion kay we have a post test to see if you have really listened to our discussion. So for the instructions, write the letter of the correct answer lang, ha. So for the number 1, where is temperature regulated? A, hypothalamus. B, skin. C, heat and cold. And D, clothing. Tangan kag mga 15 seconds to answer. Hanap ka answer, ma'am. So next. So 2, what is the normal range of temperature? So na A, 36.6 to 37.5, 34 to 36, 34.6 to 36 degrees Celsius, and 35.6 to 38 degrees Celsius. Next. So, what is the normal pulse rate? 12 to 20, B, 15 to 20, C, 60 to 100, or D, 50 to 80? Okay. So, for number 4, a weak pulse is rated as A0, B1+, C2+, B3+.
Yeah.
Okay. So 5, what factor does not influence respiration rate? A. Age, B. Gender, C. Medication, D. Pain.
Mana.
Okay. 6. So what are the 4 vital signs? A. Blood pressure, pulse rate, respiratory rate, temperature. B. Blood pressure, pulse rate, oxygen saturation, temperature. C. Blood volume, pulse size, respiratory rate, fat percentage, or D. None of the above.
Ana.
So 7. What artery do we usually get the pulse rate?
Pulse rate.
A. Radial artery, B. Brachial artery, C. Dorsalis pedis artery, D. Temporal artery. Okay na? So 8. What term is used when temperature is greatly elevated? A. Hypothermia, B. Hyperthermia, C. All of the above, or D. None of the above.
Next. Ay, mana.
Sige, 9. Pressure in the arteries when heart contracts. What is it called? So, kumukontract ang heart. A. Diastolic, B. Systolic, C. Arterial pressure, D. Pleural pressure. Mana? Okay, for the last question sa atong multiple choice, what does pulse measure? A. Heartbeat, B. Heart rate, C. Body heat, D. Diastolic pressure. Okay, so for the last test, it's an essay worth 10 points. Oh, wait.
Mana.
Okay na?
Essay.
Oh. So for the post test na atong last na gyud is the essay which worth 10 points. So why is it important to take vital signs and when do we take vital signs and why? So I'll give you mga 1 minute to answer lang.
Wow. Mana?
Okay.
Correct answer.
So, kanang since man naman ka sa test, I'll be checking your test na after and then I'll be kanang giving you results mga maybe tomorrow or later ha. So, that is all for our kanang vital sign presentation. So, thank you for listening and then I'll be getting back to you on your test lang on the next time ha. So, thank you for listening. Thank you kayo and God bless. Bye-bye.
Bye.
Ciao!